Is it permissible for males to be treated by female doctors or females to be treated by male doctors, right? Is medical treatment between opposite genders permissible? So, first and foremost, Allah and His Rasul sallallahu alaihi wasallam provides us with guidance for every facet of our lives. And regardless of the dire nature of our particular situation that we find ourselves in, you can be rest assured there's going to be guidance available in that particular perspective of life. So there are specific guidelines according to the Shafi'i school in relation to the procedure that you should follow or how you should go about seeking medical treatment. The first is that preference should be given for a male. Preference should be given to a male doctor, right? And this is going to be your first choice. And ideally, this male doctor should also be of the same religion, especially if you have to expose your aura in any way. Okay? Secondly, if you cannot find a male doctor, then you may go to a female doctor. However, you should first and foremost give preference to a female doctor who is Muslim. And secondly, you should give preference, or rather you should see that female doctor with somebody, right? With either her mahram being present, which is unlikely, or you don't visit her alone, but rather you take your wife with you, you take your mother with you, you take your sister with you. And then when actually treating or being treated, you should only view and touch that which is absolutely necessary to view and touch. So if it is possible to not remove your clothes, etc., then you should stick to that. The same thing applies to a lady, right? A lady seeking medical treatment should firstly proceed to a female doctor who is Muslim. If she's unable to find a female doctor who is Muslim, then she should proceed to take a female doctor who is non-Muslim. If she's unable to find a female doctor who is non-Muslim, then a male doctor who is Muslim, but she should be accompanied by a mahram when visiting him. Or alternatively, at least another trustworthy female, right? If she cannot take a mahram with her. And finally, if she's unable to find a Muslim male doctor, then she may proceed with a non-Muslim male doctor. But again, it is essential that she does not attend alone, and still that viewing and touching should be limited to that which is necessity, and Allah knows best. However, there are other scholars like the 4th century jurist Ibn al-Qas, who held that treatment between opposite sexes would be permitted even when a same gender doctor is available. Imam Nawawi speaks about this in Rawdat al-Talibin. Though this is not the official view of the madhab of Imam Shafi'i, it is still a view that may be practiced on. So the conditions that we mentioned should be adhered to ideally. However, the view is available if you find yourself in a situation where what we presented would be too difficult, and Allah knows best. So remember, looking and touching are permissible for medicinal things like bloodletting, cupping, medical treatment and the like, when there is a real need, right? And the need should be treated accordingly. In other words, if there's a need to see the arms and the legs, for example, then you shouldn't expose beyond that the torso and the like. So may Allah subhanahu wa ta'ala grant us the understanding and save us from bad health or from needing to be treated by a member who is going to create problems for our religious well-being. And if you find yourself in a situation such as that, know that you will not be sinful if you follow through with what has been advised, and Allah knows best. Then the last point that I wish to mention is that necessary treatment of face or hands permits looking at either, of course. For other parts of the body, right, the permissibility is going to go hand in hand with the severity of the need for the treatment, meaning that there must be an ailment such as like a severe ailment that would permit tayammum, for example, if you need to expose, the private regions. The not prohibition, but the warning should be very top of mind, because that is going to be the most dangerous, element. So if it is in terms of gynecological examinations and the like for women, or fertility issues, it's still permissible, but you have to follow through with the most precaution that you possibly can. For example, if a woman is going to need to expose her private parts, she could still cover her feet, her legs, and her upper torso entirely if she takes those precautions ahead of time, and Allah knows best. So at the end of the day, we can still, receive the medical treatment that we need, but we should try our best to take whatever precautions we need to when we need to expose some of our private regions. Wallahu subhanahu wa ta'ala a'lam.
La ilaha illallah Muhammad Rasulullah.